Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. It's another round of restrictions in Ekiti State as government introduces new limitations over COVID-19 surge, worship centers and other gatherings not to exceed 50 persons. Pharmacists ask federal government to look beyond health centers to involve community pharmacists in administering vaccines. And Australia's Melbourne to remain in lockdown for a second week after reporting new COVID-19 cases. According to the World Health Organization, available data shows that WHO's approved vaccines provide substantial protection against severe disease, hospitalization or death due to the Delta variant or other variants. But while the world races to vaccinate its population, not all regions are on equal footing. Vaccine inequality remains a big challenge to low-income and poor countries. Africa is one region, with the Africa CDC reporting less than 2% of the population that have received a complete dose of the COVID-19 vaccine. Meanwhile, in the latest report from the NCDC, Nigeria recorded 610 cases of the virus and 2 deaths. The infections were recorded in 13 states, with Lagos taking the lead, followed by Rivers and Akwa Ibom.
There has been a rise in the number of daily COVID-19 infections in recent times, triggered by the highly transmissible Delta variant, which has also led to an increase in fatalities. In the last 24 hours, the Nigeria Center for Disease Control announced 610 confirmed cases reported from 12 states and the FCT. Lagos accounted for the state with the highest number of infections, with 281 cases, followed by Rivers with 152 infections. Akwa Ibom came in third place with 85 infections, while Ogun and Oyo registered 21 cases each. Ekiti recorded 14 cases, 13 were registered in the FCT, 7 cases were reported in Delta, Edo had 6, Ondo 4, while Bayelsa, Kano, Plateau states registered 2 cases each. There were 0 cases reported from Kaduna and Sokoto states. The overall count of confirmed cases in Nigeria now stands at 179,118. There have been 149 discharges in the last 24 hours, increasing the total number of recoveries to 166,131. The NCDC also reported 2 additional deaths from COVID-19 causes in the last 24 hours, raising the fatality toll to 2,194. Presently, there are now more than 10,000 active cases in Nigeria, while over 2.5 million samples have been tested so far. In Africa, there are over 7 million confirmed cases and more than 178,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 204 million, while more than 4.3 million deaths have been reported so far.
In Ekiti State, it's a reinforcement of COVID-19 restrictions as the state records almost 100 cases in 5 days. The governor, Dr. Kaide Fahimi, raised the alarm in a statement that he is not leaving anything to chance as the third wave is now pronounced in the state. The governor reintroduced some restrictions to include the rule of 50 for public gatherings, including religious institutions. Schools must be fumigated. Well, for the rest of the story, here's our correspondent, Babajide Agbeyo.
COVID-19 restrictions are back in Ekiti State. The state government is obviously alarmed at the rising number of cases, 85 in 5 days and 180 in less than 2 months. Consequently, religious worship centers will only be able to accommodate 50 people per time, except on approved worship days. And all public gatherings must also not exceed 50 people, among other restrictions spelled out by the state government. Government explains that a surge in number of cases can also be traced to its scaling up of testing across the state. Meanwhile, the state government has advised that vaccination should not stop people from getting tested, as the number of people yet to be vaccinated suggests that caution be taken.
We still need to continue testing. Either you have taken the jab or not. We have said of infection now that you have taken the jab does not actually preclude that you cannot be infected. So we still need to know, and when you are infected, you can still be a risk to the populace. in terms of spreading the disease. And that is why we are still advising people to continue to use the face mask, to wash their hands, and to still maintain social distance, because the percentage that have been immunized, that have been vaccinated, compared with the populations, is very minimal. And that is where we are still worried, because if A has gotten the jab and B has not gotten the jab, there is still a risk in the society.
The days ahead will definitely reflect the level of compliance and awareness on the part of residents. Babajide Agbeyo for COVID-19 update.
And from the southwest to Adamawa, where the state government says no case of the Delta variant of the virus has been recorded since the upsurge of the third wave in the country. This disclosure was made by the Executive Secretary of the Adamawa State Primary Healthcare Development Agency in Yola, the state capital. According to him, the Delta variant is a pandemic of the unvaccinated, which has severe consequences on those not vaccinated.
The spread of COVID-19 in the northeastern region of Nigeria is raising concerns on the vulnerable population living in these communities, especially due to the lack of healthcare services. The government of Adamawa State, however, says it has acted aggressively in managing the spread of the disease, as it is currently one of the states with a low record of cases currently on admission. The discovery of the Delta variant has drawn focused attention due to a surge in COVID-19 cases. But how much do the residents know about the new strain?
It's not yet in Adamawa. Maybe states that those entry states, Lagos, Abuja, and maybe the states that we can find one or two cases like that. We here, we don't know.
Nobody observes the protocols again. You don't see people wearing face masks. You don't see people washing hands. These are the things that they were emphasized at the early stage of the pandemic. You go virtually everywhere, even in market squares, you see buckets of sanitizers and here and there. But today you don't see them even in public buildings. Most public buildings, you don't see these things anymore.
The state, however, says it has no record of the highly transmissible Delta variant.
Currently, as at now, there's no Delta variant in Adamawa State as detected. However, we noted with concern globally the Delta variant and the current third wave even experienced in some parts of the country and also in parts of the world is actually a pandemic or an epidemic of the unvaccinated. The Delta variant has a very severe consequence and outcome in those who are not vaccinated. I want to urge the people of Adamawa State to take advantage of the second phase that we are about to launch. Whoever has not received or has not gotten vaccinated should please avail him or herself at the nearest facility and get vaccinated.
While the state awaits the next batch of vaccines, it says it will work to heighten surveillance aimed at containing the third wave of the pandemic.
President of the Pharmaceutical Society of Nigeria is asking the Presidential Steering Committee on COVID-19 to look beyond the health centers for vaccination by expanding its net to involve community pharmacists. According to him, both the federal and state governments are not doing well enough in terms of vaccination and delivery by depending wholly on donations to import vaccines. Mr. Samuel Habonwa asked the federal government to improve its funding for research to contribute to the world to avert outbreaks of ailments either within or imported. He was speaking on the sidelines of the Full Gospel Businessman Fellowship Program in Jalingo.
We have large resource base in Nigeria. The private sector, the public sector. We are all resources. Now, government has a tunnel vision. When they talk about health care resources, they are thinking of public health care resources. But both the health care resources and the private health care resources belong to our country. For example, the community pharmacies. Community pharmacies are in all over the world regarded as opportunities for healthcare delivery. In America, when COVID came, they were using community pharmacies to conduct tests. Now, community pharmacies are giving vaccination. But Nigeria is not using any such thing. They're looking at only the health centers. That's an area I think they need to do better. So in terms of vaccination and delivery, government is not doing well enough. They need to expand. Second area is that we don't have to depend on donations only. Government should spend its money in importing vaccine. We are waiting for COVAX. We are waiting for the United States. That's what we've done in polio. That's what we've done in diphtheria. That's what we're doing in every disease area. We depend on the world. I think that's not good enough.
The Director of Research and Head Microbiology Department, Nigeria Institute of Medical Research, NIMA Lagos, joins us now. Professor Rosemary Aldu, thank you for joining us on the program.
My pleasure.
Let's first ask, do you agree with involving community pharmacists to sort of expand the vaccination exercise?
Well, I think it's a good idea. It's been used in some countries of the world, but that may not be our challenge right now. Currently, we don't even have enough doses of this vaccine. We have only covered about 0.7% of our population that have been fully vaccinated. So we need more vaccines as at now. So it's not the points for delivery. We don't even have enough. So I think we should focus on that. And if for as long as we continue to depend on donors, we may not have enough. Okay, so we also need to strengthen local production, which I also know that, for instance, in my institution, Nigeria Institute of Medical Research, we are conducting some studies in the development of vaccines, though still at the preclinical phase, okay? But the Central Bank of Nigeria has some funds, intervention funds, to support production of vaccines, development of vaccines. And so if one has an idea that can result in the translation of a product, they'll get funding for that.
So you're saying there's access for research for vaccines?
Yes, there is. There's some funds that have been released for this. Aside from that of the CBN, I know that in my institution, we just got some intervention funds. And last year, during the restrictions and movement, we had some private sector organization supporting us. I do know that the kit that was developed in my institution, a PCR-based kit, was supported by a philanthropic organization. So I think that in as much as I don't think the government can do it all. If we have others also join hands, I'm sure we will make a huge step in that direction.
So let's look at the vaccines. We have the Moderna, which hasn't been rolled out yet, and we're expecting Johnson & Johnson. Break down the efficacy of these two vaccines.
Well, in talking about the efficacy of vaccines, generally, all the vaccines are effective. And looking at the figures that have been quoted in literature, it's not good to compare directly, okay? Because sometimes the time points they are measuring may not be the same. However, all the vaccines that have been approved by WHO are effective. In as much as Moderna it's just that the method of delivery of the technology that has been used in the production is slightly different. While the Moderna is the messenger RNA vaccine, the Johnson & Johnson is a viral vector. Okay, the only issue with the Moderna is that it requires cold storage. And we are aware they also got some the government has also got some cold facilities. But the Johnson & Johnson and the AstraZeneca that we have used in the past, the +4, that is the refrigeration temperature, is just good enough. So looking at all of this, all the vaccines that are available are effective, and I think anyone that one has access to, you should just go for it. If you have different options to choose from, I think you're just lucky.
All right, we still have Professor Aldu in the studio with us. We'll go on a quick break. When we return, we'll also talk about the virus trends in Ireland and other parts of the world. Stay with us. Welcome back, and we've been talking with the Director of Research and Head Microbiology Department at NIMA, Professor Rosemary Aldu. Thank you for your patience. Still talking vaccines and vaccination. The Moderna, like the AstraZeneca, is 2 doses, but we hear the Johnson & Johnson is just a single dose. Why should, perhaps in terms of people who want to choose, if they have a choice, I mean, we don't have so much vaccine, so, being spoiled for choice is another thing. But then, why the difference? And You know, why would one person decide to take Johnson & Johnson and perhaps not the Moderna?
Well, the Moderna is 2 doses, just like you have said, and that is what the manufacturers recommend, and that is what has been approved. While the Johnson & Johnson is 1 dose, in as much as it's 1 dose, I do know that research is going on by the manufacturers to consider a 2nd dose. Maybe it will even improve its efficacy. So I think that if it's just 1 dose and we can give more people, that would be fine, because half bread is better than none if we have 1. And but all of these things is still the donors that are still providing it. But it doesn't really make much difference. The important thing is that the individuals that get these vaccines are protected to a great extent.
Let's talk about the major, if there are any, major severe side effects to the vaccines. We know at the beginning, AstraZeneca, there was the blood clot for the 0-point-something percentage. But for these other vaccines, have you heard of any?
Well, these vaccines have side effects, just like any other vaccine. It's not unique for the COVID-19 vaccines. I do know that even children, when we're taking our children for immunization, they will ask that we give them paracetamol when we get home, you know, so that if there's any fever, it will subside. So it is not peculiar to COVID-19. There are some side effects. For major side effects that have been reported, really very rare. They are really very rare. And if you are to weigh, some of them include swelling arm, you know, and some allergies and blood clotting, just like you have mentioned. But if the issue is just weighing the risk and the benefits, the risk of these side effects and the benefits of the vaccine, the risk is much lower than the benefits. There's more benefits from taking these vaccines because certainly it will reduce severe symptoms if one gets infected, and then the rate of hospitalization and death also reduces. So I think there is more benefit in taking these vaccines than the risk. But even at that, those that are delivering these vaccines also have been trained on how to manage these things if they do occur. Right. And of course, even at the vaccination centers, they will ask that you wait some minutes, 15 minutes or thereabout, for some observation before you're let to go. So it's still safe taking these vaccines. All
right, we appreciate your time. Thank you so much for joining us on the program. Director Research Head Microbiology Department with NIMA. Thank you for joining us.
My pleasure. Thank you.
And to other stories, according to the World Health Organization, the management of blood supply in response to the pandemic outbreak of COVID-19 is necessary to respond quickly and mitigate the potential risks to the safety and sufficiency of blood supplies in any emerging infectious threat. And as part of its social responsibility, members of the Nigeria Union of Journalists in Yobe State are donating blood to the vulnerable persons in the state.
We journalists, our objective is not only to inform the general public, but also to give our quota to the general public, because we have been going around, most especially the hospitals in the states, and we have been seeing people that need serious assistance, most especially buying drugs and even buying the blood itself. So we just decided today we will visit the hospital and donate blood free of charge.
All people that need this blood will be used according to the protocol of the hospital, especially pregnant women, those that are going for CS, then those that come from a road traffic accident, and you know the present era that we are in now is an era of severe form of malaria, and usually malaria used to come with severe anemia, so it is going to be used.
And elsewhere, more cases of COVID-19 are being recorded in Ireland, with fully vaccinated people accounting for 17% of new cases. Last night, Ireland recorded over 1,500 cases, with the government calling for residents to get vaccinated. Dr. Monica Perez-Oike is a general practitioner in Cork, Ireland, and she joins us now virtually. Thank you for joining us on the program.
Hi, good evening. Thanks for having me on.
All right. What can you tell us about the virus curve in Ireland at the moment?
So, as you rightly said, there's about 17% of cases now in fully vaccinated people. So there's a slow trend in the past month. So if you take a look about this time last month, there were under 500 cases of COVID-19. But since about the start of this week, we are over 1,000. But the good thing is that even though there are more cases recorded now, there are not that many people in the hospital or ICU, which we are trying to achieve by getting people vaccinated.
Are there still restrictions like remote working and others which were in place at the peak of the pandemic?
There are some restrictions still there. So when it comes to remote working, the general consensus is that if you can work from home, you should still work from home. Initially, towards the start of the year, there was like travel restrictions and basically everything was closed. You couldn't leave your county or state. So that is up now. And then things like your dining. So we then started off with like outdoor dining, and that's open. So, and then just about 2 weeks ago, we now have indoor dining. But the only caveat is that is just for fully vaccinated people and also people that have proof of COVID-19 in the last 180 days.
Dr. Oike, tell us about the extension of the vaccination program, and this is for young people who obviously face greater risk from increased social mixing.
Oh, I'm so glad. So from tomorrow, that's Thursday, children from the age 12 can now register to get vaccinated against COVID-19, and the vaccines that are going to be available will be the mRNA vaccines, which is the Pfizer and the Moderna vaccines. I think it's a fantastic idea. The vaccines have been gone under rigorous research, and actually the EMAs have already authorized the vaccination for kids from the age of 12 a couple of months ago. So Ireland is just cautious when we're doing things like this. So really happy about that, because children are also getting COVID-19. There's a report that for every 100,000 child that gets infected with COVID-19, one of them ends up in the hospital with severe illness. So we don't want that. So really happy about that news.
All right. We'd like to thank you, Dr. Monica Perez-Oike, General Practitioner at Cork, Ireland. Thanks. Always a pleasure having you join us on the program.
Thanks for having me on. Take care.
Take care too. And to other stories, we're seeing that Australia's second biggest city, Melbourne, will stay locked down for a second week. And this is after reporting 20 new COVID cases as it struggles to stamp out infections. We'll hear more from around the world in the Global Update.
Australia's second biggest city, Melbourne, will stay locked down for a second week after reporting 20 new COVID-19 cases as it struggles to stamp out infections caused by the highly infectious Delta variant of the pandemic.
Through information overnight, through these results overnight, we have added, in fact, to the number of mysteries, the number of unanswered questions out there. That's why, sadly, today, the Cabinet of the Government, we have met and we have determined to accept the advice of the Chief Health Officer to extend for a further period of 7 days till 11:59 p.m. next Thursday. This is very challenging, I know, for every single Victorian who would like to be going about their business. I'd like to be open and have a degree of freedom that's simply not possible because of this Delta variant, the extreme infectivity of this virus, and the fact that within a very short space of time, if we were to open, then we would see cases akin to what's happening tragically in Sydney right now.
Over in South Korea, the country has reported more than 2,200 new daily COVID-19 cases, a record since the pandemic began last January. It comes as the country grapples with its worst COVID-19 outbreak to date. Despite having tough distancing measures in place for over a month, Infections have spiked due to the spread of the more transmissible Delta variant and a rise in domestic travel over the summer holidays. Several cities in the Greater Manila area have ramped up their vaccination campaign with more slots and hubs as residents rushed to vaccination centers after false rumors spread that they would not be able to leave their homes if they were not vaccinated. The number of slots available for residents to get their vaccinations have been increased, while several vaccination centers have been operating 24 hours, depending on vaccine supply. Schools and stadiums have also been converted into makeshift vaccination hubs. Over in the United States, Louisiana hospitals are struggling to keep up with the huge surge in COVID-19 patients, fueled by low vaccination rates and the more infectious Delta variant. Louisiana has one of the lowest rates of COVID-19 vaccinations in the country. Nationwide, COVID-19 cases have averaged 100,000 for 3 days in a row, up 35% over the past week.
Stay safe and continue to take responsibility. You can visit our website, channelstv.com, for more updates and also a better understanding of the pandemic. You can find several other stories there, breaking news. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.